peripheral vascular disease and gangrene. In this video, I'll just be enumerating the points you need to mention in your history and physical examination. If you want to write the details associated, kindly pause the video and write. In history, write about the age and sex of the patient, which limb is affected, whether it is unilateral or bilateral, mode of onset, pain, heat and cold effects, paresthesias whether present or not, history of superficial phlebitis, and involvement of other arteries. Ask about the history of impotence, any past history of cardiac or embolic episodes, frostbite, or whether the patient is diabetic or not. Then ask about the personal history of smoking, thromboangiitis or belligerence is associated with it, and family history of atherosclerosis is often present. Then going on to physical examination. In acute ischemia, there is a decrease in blood pressure and increase in pulse rate. Now the local examination. In inspection, first note the change in color, whether there is marked pallor, congestion. Then the signs of ischemia, whether there is thinning of skin, diminished growth of hair, trophic changes in nail or minor ulcerations in pressure areas. Then we have various tests. First, on inspection, we do the Burgers postural test. From this, we find the Burgers angle. If it is less than 30 degrees, then there is severe ischemia. Then is the capillary filling time. Next test is the venous filling test. And on palpation, we look for the skin temperature, capillary refill, tip of nail or pulp of toe, then venous filling. Then Fuchsing's test, which is the cross leg test. We note the oscillatory movements of the foot. Then cold and warm test. Other test is the elevated arms test or the Roos test. We do the Allen's test. Then for AV fistulas, we have Branham's test. Then military brace test. The other test is hyperabduction maneuver. After these tests, we look for any gangrenous areas, crepitus, limb above gangrenous areas, and palpation of blood vessels. Disappearing pulse is the preliminary stage of arterial occlusion. Then we check for the other arteries: dorsalis pedis, posterior tibial, anterior tibial, popliteal, femoral, radial, ulnar, brachial, subclavian, and common carotid artery. You are often asked about the positions of these arteries, where you will find them. Then the neurological examination. In this, you'll note down after pulses the examination of the joints: interphalangeal, metatarsophalangeal, ankle joint, knee joint, and hip joint. Then the motor examination, you'll note the bulk, like for the calf. You'll take a fixed bony point, then the tone, then the power, plantar response, and reflexes. In sensory examination, you'll note the crude touch, fine touch, pain, temperature, vibration. After that, we have Adson's test. Then examine the lymph nodes and auscultation. Look for any bruit, continuous machinery murmur, or blood pressure of both arms.